Oklahoma teachers in shock. Insurance rates for their families are skyrocketing, some more than doubling. News Source Thomas Fleming is here with details. Thomas.
Yeah, this only applies for those on the Blue Cross Blue Shield Oklahoma plan. But yes, some premiums will see a 140% price hike. And now people across the state will be forced to make a decision whether to stay on their current plan or find something else.
For teachers with children, that premium went up from about $520 a month last year to more than $1,200 this year. That's the cost not covered by the state.
And is a huge cost burden to many of our educators.
Catherine Bishop with the Oklahoma Education Association says the state does pay the premium costs for each teacher and support professional.
Their individual coverage is what is covered.
But it doesn't cover everything.
What's not covered is dependent coverage.
For state employees, it went from about $560 to more than $900. The difference, 75% of that is covered for state employees with dependent coverage.
So I've never seen anything even close to this.
Oklahoma Public Employees Association Executive Director Sterling Zierle says a hike of this magnitude is unprecedented.
Sometimes you'll have a 3% increase. I think the biggest one I've ever seen was back a few years ago. We had like a 7%, 8% increase.
But he's never seen this big of a jump in 1 year.
But 140%, come on.
Bonnie Campo with the Office of Management and Enterprise Services agrees it was a bigger raise than they're used to seeing.
That this is not coherent with what they've done in past years.
And when third-party evaluators looked at this proposal, they couldn't find data to justify such an increase. Blue Cross Blue Shield even agreed.
They did not find an underlying reason for those increases when asked. Blue Cross Blue Shield confirmed that.
So they put in place a restriction on that plan for this coming year.
We could have ultimately not given Blue Cross Blue Shield as an option, but we thought at the end of the day, people have a right to choose their health care. And in this case, we just simply wanted to restrict enrollment to those for a new plan.
But she is emphasizing that there are other carriers available.
We also have plenty of plans that did not see increases.
One thing that the OEA president did point out to me is that these premium raises also affect support professionals like bus drivers and custodial workers. I did contact Blue Cross Blue Shield Oklahoma, and they sent me back a statement. They're defending their rate increases, saying they are competitive, and encourage members to call if they have questions.